everyone. It's another Wednesday with your. Oh, I beg your pardon. It's Friday.
Thank God
Oh,
it's
yeah.
Friday.
Thank God it's Friday. Oh, yeah. So, it's another Friday with your fertility specialist on behalf of Alps Hospitals. I love to say thank you to our dear viewers. Thank you for liking our posts. Thank you for always staying glued to our screen. Thank you for staying tuned, for always connecting to our sessions, for watching our videos, for liking, for sharing. Thank you guys so much for always engaging us. As we get started, please share this link with someone, call up someone. Feel free to drop your thoughts, your comments in the comment section, your question as well, and we'll definitely attend to them appropriately. I'm your host for today, Ruth Ogogo. So today we are talking about myth in fertility. And to talk about myth in fertility, we have Dr. Deborah Olubiyi with us today. Dr. Deborah, it's good to have you.
Thank you, Ruth. It's always a pleasure to be here. Good afternoon, viewers.
Oh yes. So for someone watching for the first time, a bit about Dr. Debbie. She's a family physician. She's an IVF specialist, a fertility specialist, and she's also the head of IVF in Alps hospitals. So that's just a bit about Dr. Debbie. We're talking about myth in fertility today. I hope you call up someone because a lot of people have very, very wrong notion about fertility. A lot of things that people hold so they cling to, which is actually not which is not true. And somehow they say what you believe in somehow just has a way
Yeah.
of yes. And then imagine you're believing or holding on to the wrong thing. So it's good that you call up as many people today so that people are able to debunk all myth that they are holding so dear or they are clinging to and struggling to actually drop because they are actually not true. Today, Dr. Debbie will tell us a bit about some of these myths. Well, I would say fertility in Africa is something that a lot of and the fertility interventions that are available to people generally in Africa is something that I think Africans are still struggling
Wait, to come to
to
terms with,
yeah,
yes,
yeah.
yes.
So well, with your experience over time, what are some of these myths that people actually stick to, hold on to, and they just feel like they are so clingy to those wrong notions,
Yeah,
even when they are knowledgeable. Still, it just
yeah,
seems like those myths has really is stuck with them for life.
yeah. A lot of myths. And these myths will now dictate the way people think and the way they behave.
Yeah,
It will dictate whether they quickly, uptake, they are quickly open to, seeking help, medical help,
yeah,
and so on. So a lot of them, I think one common one in our society, African society, that I've seen is that people believe that infertility is a woman's problem. You see this a lot in the
yeah.
consulting room.
That's true.
People believe once a couple is struggling with fertility, the woman is the cause, and the
That's
woman is the one
true.
to blame. And we see that that is so untrue. There's no scientific evidence to support that, because we see that about a third of the causes of infertility is caused by women. A third is also caused by male factors from the men. And then in about a third of cases too, it could be a combined thing. The
Yeah,
man contributing, the woman contributing. And
contributing.
you see this story playing out so well in the clinics, during consultation. You see a woman coming in at 40s, they've been married for years, no
No
child,
child.
and it's at that point now they're coming to seek help. And this was a woman that was married at about 25, some 26,
Wow.
in her peak fertile period. But
Yes.
because they believe this issue is her problem, and then only for you to evaluate and you see that the man was the cause of the problem. Maybe
Problem.
azoospermia, low sperm count,
And
other
all
issues in the
that.
man. And all the fertile period, the active young age of this woman was wasted.
Yes.
And they come at this age when we know that ovarian reserve has declined, and the chances of getting good quality eggs from this woman is very low. So I think that's one myth we need to debunk. Infertility is not a woman's problem.
Problem.
Yes, it's a problem for the couple, and both couple need to be evaluated. Both partners need to be evaluated, not just the woman. The man needs to be evaluated, the woman needs to be evaluated. And this will also help our society, so that once there's infertility,
Yes.
everybody's eyes
It's on the
is on the
woman.
woman.
That's true.
They're touching her tummy, no pregnancy,
Exactly.
Maria, what's happening?
Yes.
Everybody's eyes is on the woman, and she just takes the fall, take the
And
blame.
all
I
that.
think that
Yeah.
should stop. Infertility is not a woman's problem.
It's
Infertility can can stem from the man. A man can be the cause of a family or a couple not having children.
Yeah.
Yes.
It's really sad because sometimes you even see the in-laws blaming the woman, whereas it's their
Yes,
son or
it's
their
their
brother
son.
that
And
has the issue. And
yes.
the woman will not ask,
And
she will not
do
be
you know
bold or
sometimes even
hi.
when the couple know, the woman still covers the man.
Yes,
The
it's
way
just
women
so
are brought up,
goodness.
you want to shield, the woman still covers the
Yes.
man. A lot of couples, the man is the problem. They are both aware, but this woman will still take
Hi.
the blame and still covering the man. But when a woman is a problem, most times there are some men that cover the wife. You see the man exposing the woman.
Yes,
It's
exactly.
really very unfortunate.
It's really,
It's
in
really very
fact, this
unfortunate.
our African society where they make the woman feel less of a woman
Yeah,
once
this
all
kind
this
of
are
society we
happening.
have, we're in a patriarchal society. They feel a man is the head. Yes, we know a man is the
Yeah.
head. All women are subservient. And the way our culture, a man is always right, a man cannot be wrong. Those things need to change. Those things
Yes.
really need to change.
And one thing, men, I think you all should also keep your minds open. Like Dr. Debbie has let us know that the man can be an issue. And sometimes some men will even rub it on the woman's face that then when I was young, some girls were pregnant for
For
me,
me,
they terminated. If not, I was not ready to carry, and you'll be like, are you sure you're really the father?
we're seeing it now with all
Yes,
this paternity
exactly.
testing
And all of
all
that,
over now.
yes.
Yeah, we're seeing it now.
They struggle
Yes,
to come to terms with the
yes.
fact that okay, they could actually be the
Yes,
issue.
and some of these ladies outside or side chicks, they call them,
Yes.
they know that this man is out for a child in this relationship. So
Yes,
anybody's child they can dump on you. And the man
exactly.
is there
That's true.
feeling is,
He's a
not
man.
knowing that. So
It's honestly, it's actually as funny as it sounds. It's really pathetic sometimes when we've seen a lot of women that break down because they've been young and because their husbands are yet to accept the fact that they are the issues. They now
yes.
get to the point where they don't have eggs anymore. Maybe that time the
Yeah,
man
and
is now beginning to
yes.
try to come to terms,
And
and
a
then they are
lot of
now.
these men do not want to seek help.
Hi, it's
The
just
fact that you have a problem, it doesn't reduce the manliness. You see this
exactly.
thing really hitting them. It doesn't reduce your manliness. Being a man is not just fathering a child. Other
Yeah,
attributes make you the man, make you the head of the family.
true.
But a lot of men, they find it very difficult to come to terms with this this
Yes.
fact that maybe they are the cause, and because of that, they shy away from
From
treatment.
it,
They will be at
yes.
home until
More
this
forms of
woman
leaves her her
enters
fertility
menopause.
peak, yes.
Exactly, until she enters
They will now be
menopause.
telling the woman it's donor
Yes,
egg, so she has lost the chance
yes,
of being able to
to be the one to
bear
produce eggs.
exactly.
Ex-
It's really sad actually. A lot of women fall into this category that men are the issues, but they struggle to come to terms. Maybe when
Yes,
they now see the pressure is more 15 years down the line, when the woman's fertility is off, they will
yes,
now come. The woman will now be struggling with having to collect donor egg, and even the
yes,
man still will not accept the donor sperm. He will now that because since technology has made it easy that sometimes even with their poor sperm they could still do some
yes. We
treatment
could do
and the man can
ICSI.
still
Yes,
benefit from having
but this
having
woman has no
children
eggs.
exactly from his sperm. But
Because
now
a
this
man
woman has
continues to produce sperm, but a woman is born with all the eggs you ever have at
yeah
birth. You don't produce new eggs. There are technologies like ovarian rejuvenation that try,
yes
to stimulate our ovaries to produce new eggs, but it's
yes
not everybody that can, uptake that service,
yes
and it's not a hundred
exactly
percent. It doesn't
yeah
work for everybody. So you imagine this woman, no more eggs, and the man is still able to produce sperm. So who
exactly.
loses out at the end of the day?
Exactly.
Hmm.
So at that point now, you now feel it's equal. The woman has problem, you have problem.
Thank you. So we're on the same
Well, on the
level now.
same level. I mean, we don't have to get to
We
that
don't have
point.
to get to that
We really
point.
don't have to
Yes.
get to that point.
Yes.
And nobody may well. I know Dr. Debbie still has some more myths. We this is just one of the myths that
Yes.
which we know greatly affects us in Africa. Yes, we
Especially.
don't know. Yes, Africa especially.
Yes.
It could be in the world, but Africa it's very peculiar with us in Africa and Nigeria. Let's narrow it down to Nigeria. Yes, Nigeria.
Yeah, I think
So there's
another
some more
common
myths.
myth I've seen is that, people feel that infertility is something that happens to people that are old. But we see
Mm,
a lot of young ladies, or should I put the young couples, the man
yeah.
and the woman, having this issue of infertility, because infertility can be caused by a lot of factors. Yes, we know age, can contribute to infertility, like we've mentioned now. As a woman tends towards the perimenopause, menopausal age,
Age,
as a
yes.
woman tends 40s, that store of eggs is almost depleted. So
Yeah.
if you've not had your children earlier in life, it will be more difficult to have children. So infertility is very common. But a lot of young people, young ladies also have problems that make them infertile. So
Fertile.
infertility is not just a problem with older age women. It also
Mm.
happens in younger age women. That's why we counsel that if you've been married and you've been trying for up to a year and no pregnancy is coming, please come to the hospital to be
Hospital.
evaluated.
Mm.
Don't feel that, oh, I'm young, yes, so I'm very
Mm.
fertile. No, it doesn't always play, because a lot of genetic issues, there are a lot of conditions like polycystic ovary syndrome, severe endometriosis, other issues that could make you infertile at a young age. So it's not just a problem for the older age women. And that's why we counsel on early, early resort to seeking medical intervention.
Attention.
Come to the hospital, be evaluated, and then be
Yeah.
told that we can't find anything wrong with you. That is better than you sitting at home and holding on to this wrong myth that because I'm young I can't have problems with
With
getting pregnant.
fertility, yes.
Yes.
So, viewers, hope we're noting that the fact that you're young doesn't mean you can't actually have fertility issues. And do not be shy to seek help.
Yeah.
Do not say, okay, they say when you maybe we hear say, what see you define? You still young now. Please don't allow
Exactly.
that to don't
Yes.
allow that to put you away, because it's for your own benefit. At least it's better. Pregnancy and all its outcome is better when you're younger
Younger. Yeah.
than when you're older, and that's why you shouldn't shy away from it. You know what you're looking for, so do not mind whatever people say. And for those people that criticize people, please stop that, because it's all for their own good. It's not big, everybody wants to carry their own children. Most people, now let me not say everyone, because there are some people that will say they don't want children, but most people want to carry their own children.
Yeah.
Most people want to carry their look alike. They want to see that their son or daughter looking like them or carry some traits from them. And so you shouldn't shy away from it. You shouldn't um resist the urge to want to seek help. It's
Yeah.
not strange. It's
Yes.
not out of place. It's not coming out of the blues. And you are not abnormal. You are
You're
normal.
not. You're not.
Do
You're
not feel
not.
abnormal
Yeah.
about it.
Yeah.
Yeah. So maybe let's take some more
Yeah,
myths
so
then.
this one also um, brings to mind another misconception or myth that people have, that infertility is rare. Infertility is becoming more common
Come on.
in our society now. In
Seems to be
fact,
growing with the age.
it's too, because there are a lot of issues now. Is it
Yeah.
the environmental pollution? Is it the carcinogens, things we
Hmm.
get from food? So many things. Plastic. A lot of research is going on how plastic, and we use a lot of plastic. Soft drinks in plastic, water in plastic
A
plates,
lot.
utensil. Research is going on how it damages the gonads,
Hmm.
both the ovaries, damages the testes. So infertility, the incidence of infertility is really
Very
rising
high.
now. In fact, now about 1 in every 6 couple
Wow.
suffer from infertility. So
Oh.
infertility is common. We people tend to shy away from it as if it's something that is rare. It's not rare. Infertility is very common nowadays. A lot of couples are battling with
With
infertility.
infertility.
Yes. So that awareness is important, so that you don't just keep staying at home. Seek help,
Yeah.
seek help quickly, seek medical intervention quickly, because it's something that is common now. In fact,
Yeah.
it's really alarming. A lot of young people coming down with premature ovarian failure,
Failure. Wow.
young people that don't have eggs again, the ovaries failing even before the time it's supposed to fail. I know it stems from the kind of environment and society we live in now. And that you even see that nowadays cancers are on the increase too, from the kind of society, the food, all this genetic manipulation of food and all
Yeah.
that, so it's having an impact on the body. So infertility is very common. That's another misconception
Perception
people
that
have.
people
They
have.
think it's
Okay.
something rare. They think it's something that happens to 1 in a million people.
It's not
No,
far from you
it's not far
anymore.
from us
Omo.
any
A lot
longer.
of you might just look around and you might see
Yes.
one or two persons that actually is no longer as rare as it used to
Was
be back
before.
then. Yeah, it's really,
Yes.
really becoming common. It seems to be
Yes.
growing with the age you are in right now, because it's
Definitely.
it's really worrisome. Fertility issues seems to be on the increase, and
Yeah.
that's why we must try as possible to maintain healthy lifestyle, so we're able to
Yes.
some extent still
Yeah, to
preserve
some
our
extent,
fertility.
that's
Yeah.
another mean. Yes, to some extent, a healthy lifestyle can help to reduce, the incidence. But then it will also still boil down to the cause, But
Mm.
the causes that can be linked to the way we live,
Yeah.
those causes will be, will be on the incidence will be low. So a healthy lifestyle can help. But some of these causes of infertility are even genetic, things we're
Yeah,
born
it's
with,
true.
Some
True.
congenital anomalies, some genetic diseases that people are born with can all affect the fertility of couples. But a healthy lifestyle will always help.
Like they'll say, life no balance. Some people will live very healthy and they'll still have fertility issues. Just where they'll say, I've been a good girl all this while, and now it still comes to having to try to even
Yeah.
conception becomes difficult. So yes, life no balance, but it doesn't mean you should live anyhow still.
Anyhow, yes, because
Exactly.
living anyhow too has an impact.
Yes,
Yes.
exactly.
Yeah.
Okay, so some people also believe that family planning in a way affects all these contraceptives
Fertility. Yeah.
affects fertility. I maybe
Yeah, so that's
talk a bit.
another wrong misconception, another myth.
Mm,
Yes, family planning is to help you delay fertility or plan your family. And for
yeah,
most family planning methods, once you stop, there's within a few weeks, a few months, you return to fertility.
yeah.
Those that there might be some more delay, which is just about 6 to 12 months, are those that go on the injectable, family planning like
Mm,
Depo
mm,
Provera, Noristerat. But for
mm.
most family planning, intrauterine device and others, implants, return to fertility is almost immediate.
Immediately.
That slight delay is just for your body's system to return
So
back
it's
to normal. So birth control methods do not cause infertility.
fertility.
Yes,
Mhm.
they do
So
not cause infertility. You will always return back to fertility. So that's a notion we must really correct, because this will
mm,
discourage people from taking up birth control or family planning methods.
yes,
Yes, and then
that's
having
true. A lot of them
unwanted
are
pregnancy.
scared and all
Yes,
of
no,
that.
they do not. And
Mm,
you shouldn't do a birth control method because your friend is doing it. Please
yeah.
see your health, personnel. You are examined. Questions are you ask questions.
Mm,
Some of your vitals are checked. That your measure, your screen for diabetes, for hypertension,
and
because
all of
that
that
could also help them counsel you on the best, method for you
for
to use
you.
that would,
Mm,
go down well with your system. My friend collects injection, I'll go and collect injection.
mm,
My friend is taking pills, me to know. It shouldn't be that way. You should see your health personnel, have a discussion, have an evaluation, and then together choose the best method for you.
mm.
But they do not cause it.
So we take hope you said that. So we're not scared of it. You're ready to do about child spacing or your family planning for when you don't want to give birth anymore. Do not be scared of it. Do not shy away from it. If you know one or two persons that maybe after they move their family planning, they still have infertility issue, it's not because of family planning.
Yeah.
So, yeah, as age,
The
whenever
issues might
exactly
have been
some
there. Yes.
issues begin to rise up
Yes.
that
Yes.
you cannot say it's the family planning
Planning
thing
that
they did
cost.
that actually
Yes.
caused it. It might just be coincidental or
Exactly.
accidental that okay, everything happened about the same time. But it's not, it doesn't necessarily we have heard of countless people that as soon as they're taking up maybe one implant or the other.
Next cycle, they don't even
Yeah,
see their period.
exactly.
And they're
Pregnancy,
pregnant.
boom, happens. So assessing proper maybe after counsel from your specialist to help you see some of these family planning methods and your clarity with them with the best of counsel, and please feel free to embrace any one of which that would want to embrace. Well, I'm okay. Sometimes some men feel the fact that they can, like the word they will use, perform,
Yeah.
yes, and something about they feel automatically fertile. So maybe when you start doing analysis and you're telling them you're not seeing anything, and they're
Yeah.
like, "So what's that coming out?" Maybe you should just enlighten them a bit because they just feel every man automatically once that thing is coming, I'm a fertile man. I can feel pregnant. Mm.
Yeah. So what comes out is there's some seminal fluid cells causes the woman to get sperm cells. So you
Yeah.
can have just the fluid and the sperm cells. So that's why there's a test called seminal. We analyze the fluid to
Mm.
look for the sperm cells.
Mm.
Yes, because that is what gets a woman pregnant, not the fluid or
Pregnant.
the liquid.
Mm.
Yes, so that's why the fluid coming out, when that analysis is done, we know whether you actually have sperm cells or not.
Men, the fact that something is go and check yourself and be sure. Go and check yourself. Hope this don't show hit you supposed to hit you now so that you do the necessary thing that you need to do. Check yourself. Assume that you check out because you are seeing the fluid come out after your or after you prep or whatever it is that you call it. Just make sure you check yourself. And yes, it could change over time. The fact that you're pregnant is fine. Doesn't mean
Other
it cannot
factors can
change
affect it. Yes.
suddenly. Exactly. And that's why you don't just once you check once and you better, you keep being fertile all your life. something else could go, which we don't hope like does, but life happens. Life happens. Well, okay, so the one this that have lots of recurrent carriage, does it in any way, like maybe they have to hamper their sometimes you just after plenty miscarriages, plenty the next baby not forthcoming again and all of that.
Yeah, so miscarriages, but really evacuation. So we so that be done by police personnel
Oh,
in,
okay.
in safe environments in because there's over curettage,
Mm,
mining can be
mm,
should I use the word scrape
mm.
and encourage the formation of scars in the lining of the
Yeah.
womb, and that's pregnancy happening. Even if it's not done in a proper way, infection can set in. That infection can lead to which is one of the causes of infertility. So that's why recurring miscarriage, if it's done in a safe way and by an experienced person, should not reduce your fertility potential. When complications like infection, intrauterine, adhesions, setting that now reduces your fertility potential. So it should be done in a safe place, not by any quack in any corner or whatever.
Yeah.
And that's what some people do. They do have evacuations done by people
People.
in very dirty, not septic environments with
Mm,
infection and so on
yeah.
setting. And that's just ends their reproductive
Life
career. They are too from
and all of
intrauterine
that. Oh
additions and all
goodness.
that they can't, take it any
Baby.
longer. So that's our counsel to young people. The counsel is abstinence until you're ready for pregnancy. If you're not ready for pregnancy, indulge in what will bring about pregnancy. Abstain. And if you can't abstain, use protection, control methods. And if you must have an evacuation done by skilled professional in a safe environment.
Don't go to work and
Or
then
one quack somewhere that will just
somewhere
carry one
and just
unsterilized metal and
oh
just
my.
ah
I know of someone that she actually had an evacuation at
the
the
end.
end. By the time she was trying to do fertility check, oh my god, the lining was terribly scarred. Like almost when you she needed to have like when you say repeated hysteroscopies or which was like because it was just one operation
Vision
that
she
was done
had,
for her,
and
and
that
that was
just
it.
saved her life.
That was honestly
God.
struggling to conceive, not happening, and by the time they just peeked into it to look what's happening there, see white everywhere, and you're just like, wow.
God.
So this is how some people's fertility
Yeah,
is
so you see how
just
wrong
ended
choices,
and
wrong
not there.
can just alter your course of your life. And
It's
that's why we're on create awareness, about, you
as much as possible when pregnancies that you feel because even now, even it's not just single people that are able to tell
married
pregnancy,
people
married
are the
people
worst
do.
culprits.
So yes, now do you because
Yes,
maybe
married people
it
are the
just
worst.
suddenly happened and then
Mm,
later you and then you're terminate and then they took they now
yeah,
have to start the operation. Maybe they've succeeded in stopping the heartbeat or stopping pregnancy for progressing,
yeah.
but the contents are not coming out
Infection
completely and
setting
all
and
of
all.
that a lot. So please, as much as possible, if you're not ready for pregnancy or miscarriages, maybe pregnancies and all
Yeah.
that as much as possible. So that we don't have to do all this trauma to the
Mm.
endometrium
So
or the lining
yeah,
of okay, yeah. And then maybe talk a bit about some of the things that men do that could hamper fertility, maybe some of their
lifestyle choices
lifestyle and all of
alone.
that. Yes.
He-
Clothing they use,
Yeah.
gadgets and
So
all.
men that drink alcohol,
Mhm.
heavy drinkers, cigarette smoking, all that affects the sleep.
Mhm.
Yes. And wearing tight fitted on because
Mm.
they test at like almost outside the body because they need to be at the lower temperature in their
Temperature.
bodies. That does not allow you anything that increases the temperature.
Yeah.
Even putting laptops on your lap,
Mm.
phones close to your testes, all those things should be discouraged.
So
Yeah.
hope you are noting that.
Yeah.
And please let's take note. Take note for this for you for your children. Take note of this for your sons.
Children,
For your sons and your sons
educate
in-laws. So that their fertility could be preserved and then we don't have to. struggling or was searching for means
Yeah,
to
so
help.
infections in childhood are well treated. Even sperm and all those things can damage. Just taking care of the child, even from childhood, very
Yeah.
important.
So to wrap up, if you were to about that you just
Mm.
want
I think
completely
the one that man is
for
the
fertility.
problem, the woman is the cause of infertility. That is just too prevalent.
Mm,
Because a man feels I'm not involved, it doesn't make them seek help early.
right.
They seek help early. And then you hear the men saying, I've tried myself outside. Woman
Mm,
outside is pregnant. Please do DNA testing of those children.
I'm sure,
Test those
exactly.
that are yours.
You know that I've helped myself.
I've
I'm
helped
just trying to
myself.
help the
This
woman.
woman, exactly. So that's one ultimate I would really want to change. Because if the society ownership will seek help, we
Yes.
live in a society where men are supposedly at the forefront. Men take the family, and
No,
so if they want this problem, the family will seek help to change. So
because
thank you so much
this
for
has
having me.
been able to debunk all the wrong notions that you have about fertility. Yes, there are a lot of myths that we cannot exhaust, but these are major ones that are striking that we felt should be addressed so people are well informed and well enlightened of the right information to have about fertility. It's not too late to try to assess your fertility and be sure that you're okay. It's better they tell you you're fine as you and then
Yeah.
things are getting bad by the day. It's been good having you. I'm glad you stay with us for engaging us. We look for more in our subsequent sessions and we hope that you have a lovely weekend. For now,